What's up, respiratory world? So this is our Portex Shyly. I don't use these a lot. Well, we do use those, especially in the LTEC when the patient is on their way to being extubated. They are downsized from a regular Shyly, maybe like a 6 Shyly, 7 Shyly. These ones have a much smaller diameter. As they get smaller in diameter, it's a little bit harder to pass the catheter, but allows them to have, phonation and aeration around the trach so they can breathe out. So today, 15 minutes into my shift, while I was, getting myself ready, they called me to the patient's room. Patient decannulated themselves. Trach was out, off to the side. Oxygenation was good. Tried to put the same size trach back in with a 6 Shyly. Unfortunately, I was not able to put the trach back in, so we're kind of in a panic. Patient's oxygenation is good, but when you put the trach in, you're damaging the airway, it's causing trauma to the airway. So I put a 14-foot chunks of catheter in there. I was able to pass the catheter. Had to run and get this 7 Portex. So the 6 Shyly is a Shyly Portex, but the diameter on the Shyly is a little bit more larger. So this one has a smaller diameter. So luckily enough for me, I was able to get this one in. You want to be careful when you put in a trach into the patient's airway, because it could go into like third space. And I've had a patient before where we put the trach in, it went into the third space, started developing subacute emphysema because we bagged them, so we had to take it out, readjust it. Patient, could possibly desaturate, just have further issues. So you want to make sure you put the trach in. You're using the operator, that's that hard piece in the middle. Use the operator to guide it into place. Pass the catheter, listen to breath sounds, because you don't want to get it into the third space or some space underneath the skin. Trach, sometimes, the way the curvature of the trach, some people's anatomy is just different. So when you put the trach in, remove the operator, make sure you can pass the catheter, listen to breath sounds, make sure the patient's oxygenation is moving, and then you proceed. But sometimes, patients, they're not of cognitive, of good cognitive, abilities. So sometimes they're pulling and tugging, and sometimes they can possibly decannulate themselves. So you don't want to be too forceful, because you're going to cause further trauma and further bleeding. If you can get the trach in, then you occlude the airway and you bag that patient. Get an ambu bag, calling me now, and you get them on an ambu bag and you bag them up, and there you go.